about jobs for newly licensed nurses. Which unit should you work on? How should you even navigate this whole process? So let me talk about the very, very, very most important thing about this. Okay, this transition is tough. It is going to be really, really hard to go from nursing school to newly licensed nurse. Wherever you work, you want an organization that acknowledges that and provides some sort of support to the newly licensed nurse, whether that be a residency program, which would be my top priority, a hospital with a residency program, particularly a well-established one, absolute priority. But maybe they don't have a residency program because those are all very expensive. But they do have some sort of structure and framework or whatever it is, and mentorship and longer orientation with more education or something like that for the newly licensed nurse. And if you need a residency program, I made one. There's a link to it under this video. But anyways, but you really want to have a hospital that acknowledges how challenging that transition is, and that they're going to say, you know what, we know this is tough, and we want to support you through it. We look at the newly licensed nurse differently than we look at the experienced nurse, and that is really important. If they are going to onboard you the same way as an experienced nurse, that is a red flag, okay? Because this transition requires more support than someone who has experience coming into the role. You graduating from nursing school, they do not expect you to be at that level where you can just be shown around the unit and take on a patient load. This is not how that works, okay? So highly prioritize the support for the new nurse and also the culture. I would much rather work on a unit that's not my ideal unit, but knowing that I have a supportive culture of nurses that care about me, care about my development, are going to be kind, are going to be respectful and encouraging, versus maybe my dream job on a toxic unit, okay? So just because it's like, maybe you want to work in a level 1 trauma, emergency department, and that's your dream job. But what if that culture, you do the interview and there's a lot of turnover, the preceptors don't seem very nice, like people seem incredibly overwhelmed, and you're just like a little hesitant, but it is your dream job. And then what if you did an interview on a unit where, there's, the people that are here actually look happy and look like they care about their job, they're not angry, there's a program for you to get support through, they have a specific mentor that they're going to pick out for you, they have various things, and they're just very kind and welcoming. That's very different. I would much rather work on that unit that is supporting the newly licensed nurses than the one that's kind of leaving them out to dry and throwing them to the wolves, if that makes sense. So consider that during this entire process. It's not just all about landing that dream job out of school, and to be honest, a lot of people don't. And that doesn't mean you're a failure, and that doesn't mean that all this work was in vain, but you can still get value in other units and other experiences as you work towards that goal. So I'm going to tell you guys something that is a little controversial. Some people might not agree with me here, but I am just going to say that if you are in nursing school and you don't recognize, don't specialize yet. What I mean by that is, if you in nursing school don't already know that specialty that you might want to do, don't guess and try to do one. So let me explain. Some people go into nursing school and know, you know what, I'm going to nursing school to be a NICU nurse. It is in my blood to be a NICU nurse. Or I desperately want to take care of oncology patients, and this is what I want to specialize in. I want to be a certified oncology nurse, and I ultimately want to be an oncology educator. That's one thing, right? But if you're going through school and you're like I was, and you don't know what kind of nursing you want to get into, just taking a stab in the dark to say, hey, yeah, maybe I'll like the NICU, maybe I'll like critical care, maybe I'll like blah blah blah, but you don't have any actual experience there, don't apply for those jobs. And let me say why. What if you don't like it? What if you say, hey, this is a specialty, and I say, I don't like it, and I don't want to be here, and 6 months later, you're like, this is the worst, and I hate this. That was a $40,000 risk that hospital took on you to train you for this very specialized area, and for you to say, you know what, no thanks, that's not for me. Not cool. They took a $40,000, whatever it is, to replace you if you leave within the first 2 years, risk, and you're just no thanks, can you put me somewhere else? That's not how that works. It's very, very expensive to train someone in a specialty area. And to get that job actually right now as a newly licensed nurse at a good hospital in a specialty, it is very difficult to get the job unless you can really demonstrate that you have a passion for that specific specialty. And it's for that reason. They cannot afford to have you get on that unit and you decide, you know what, this actually is not what I thought it was. So for example, let's say you are like, you know what, I think I want to do neuro ICU and I want to do it out of school. Well, the people that land those neuro ICU jobs are people who did a neuro ICU practicum, and they know what an extraventricular drain is. They have plans to get their certification in being a stroke certified nurse, or they understand that they're going to be taking care of patients on ventilators and all this kind of stuff. As opposed to someone's like, yeah, neuro ICU sounds kind of cool. Like I saw it on this show and this, like that. That's not enough. It's not enough to convince that hospital to take that huge financial risk on you. So if you are not someone in nursing school who deeply has a passion for a specific specialty, I encourage you to look at jobs that are a little bit more general so that you can get a better feel for patient care and what you're passionate about. So I'm going to give you an example from my life. I thought in nursing school, yeah, I think I might want to do NICU. That seems like something the more critical care, taking care of the babies, that sounds like a great thing for me. So when I did my new graduate nurse residency application, they ask you where you want to work, and I said I wanted to work in the NICU. I had no experience in NICU. It just was an idea that I had that thought, okay, you know what? I think I might want to do this, and I'll be good at it. I'm going to put my heart and soul into it, and blah, blah, blah. Well, when they asked me why I wanted to do it, I essentially said something like that. And I rightly did not get that job. There's no reason, in retrospect, why I should have gotten that job. I didn't make an effort to try to get in any NICUs. I didn't look up and learn more about NICU and whatnot. I had no idea what the day-to-day in NICU was like. That's kind of like, for a labor and delivery example, like, hey, I've seen a baby story. I think I want to be an L&D nurse. Like, those are not the same. Like, that's not balancing multiple patients, like notifying like you see the patient experience, but you don't see the nurse behind the scenes, their day-to-day, their task management, their yada, yada, yada. So I did not get that job. I did get an interview in 2 med-surg units, and I took the one in a cardiac med-surg kind of step-down unit. And man, I had no idea that I would love geriatrics like I did. And I eventually learned, hey, I really like these stroke patients and neuro. And I eventually worked in neurocritical care. Would have never done that if I got a job in the NICU, the other NICU, neonatal intensive care. But so that hospital rightly did not give me that job. And I took the general job and found out, hey, this is actually where my passion lies. So if you don't know what you really want to specialize in, try to work in some place that's a little more general. Like you can still have a med-surg, but a little bit of a specialty. Like I did the cardiac surgery. There's also orthopedics, oncology. You could do step down. You'll see a little bit of everything in step down. But if you can walk into an interview and confidently say, you know what, I'm not entirely sure which specific patient population I am passionate about, which is why I would really love to try med-surg. I would really love to try step down because I know I'm going to get experience with a ton of different kinds of patients. And that's very valuable to me. And I want to develop my nursing skills through that. Like that is so wise to walk in there with that kind of understanding of the gravity of the tasks in front of you, and knowing and showing a genuine respect for this hospital who's going to invest a lot of money in your training. So consider that. If you're not sure what kind of specialty, I encourage you to check out some more general options.